Hello, my name is Jose. I'm going to be your nurse today. Is this for Steve?
Yes.
Awesome. Can I confirm your name and date of birth for me?
Yeah, it's gonna be Steve. Date of birth 9/11.
Awesome. Are there any allergies that we should take note of?
No allergies.
Okay, I'm going to go ahead and provide us with some privacy. I'm here to conduct a comprehensive head-to-toe assessment. Basically, we're going to go systematically from your head to toe, noting any abnormalities, but really just to get some baseline information for later when we have future assessments, we can compare and monitor any changes.
Okay.
Does that sound good? Is
Yeah,
this a good time for that?
Yeah.
Awesome. Okay. Cool. So, how's your mood today?
Mood's great.
Awesome. And as I'm assessing his mood, I would have been just generally taking note of his general appearance. We'll assess gait later, but his posture. He's sitting up straight. He's responding to my questions. So he's alert and oriented. Just so we can orient ourselves, can you just tell me what the year is?
Yeah, year is 2024.
And do you know where you currently are?
I'm in Alverno.
Awesome. All right. Cool. Yeah. So we're just gonna go ahead and start with some baseline vitals. So I would first start off with the temperature. So I would have like this. I would go through the temporal route. So I'm just gonna flash this machine over your forehead and behind your ear, and to get a temperature of about 86 or 98.6. I would document that as a temporal route. 98.6 degrees Fahrenheit. Then I would go ahead and assess your pulse, and so I would just palpate your radial pulse with 2 fingers for about 30 seconds. I would say 33, so I would multiply that to get a pulse of about 66 beats per minute. And the next 30 seconds, I would assess his respirations. I wouldn't let him know, just so he doesn't change in his breathing. So I would assess both of those within the span of a minute. Respirations, we'll say they were around 16 breaths per minute. Then I would verbalize these findings to you afterwards. So your pulse was about 66 beats per minute. Your respirations, as I saw while I was assessing your pulse, was around 16 breaths per minute. Both within normal ranges, as well as your temperature. Then I would go ahead and take your blood pressure. So I would apply a blood pressure cuff, and I would take 2 to 3 fingers to palpate along. Do you have a preference which arm we use? Alright, so we'll just say his left arm. So I would apply the pressure cuff, palpate for his brachial pulse in his antecubital region, and as soon as I find it, I would pump up the blood pressure cuff to get a baseline systolic blood pressure of about, let's say, 110 millimeters of mercury. That would be the point where I wouldn't hear his brachial or feel his brachial pulse anymore. At this point, I would don my stethoscope. Then I would place the diaphragm on my stethoscope where I palpated that brachial pulse. Then I would pump up the blood pressure cuff again after I would have deflated it, and up to 30 millimeters of mercury past the point of where I no longer heard systolic blood pressure. I would pump it up to about 140 millimeters of mercury, and then I would slowly deflate the cuff and note the first quarter cough sound that I would hear, which let's say it's around 116 millimeters of mercury. And then I would continue to listen until I no longer hear sounds. And at that point, that would indicate your diastolic blood pressure. So we'll say it was around 116 over 80 millimeters of mercury, and we would document that as 100. What did I say? 116 over 80 millimeters of mercury sitting in the sitting position and on his left arm. Yeah, and that's within normal range as well. Just to get a baseline pain level, are you in any discomfort at this time?
No pain, 0.
Okay, pain index on the 0 to 10. It would be a 0. Awesome. Okay, so then I would document that 5th vital sign, and that would be the end of the vital signs. So now we're going to go ahead. Now that we have some baseline vitals, we're going to go ahead and start with the head to toe. I'm going to assess your overall appearance of your head and your face. So I'm just looking at your hair distribution right now. Is it okay if I palpate your skull?
Yeah, that's fine.
Yeah, I'm just like palpating for bony lesions or any abnormalities in the shape of the skull. I'm also looking at hair sensitivity. Is there any tenderness?
No.
As I'm palpating these regions? Awesome. Okay, and his head is symmetrical. Can you go ahead and smile for me?
Yeah.
Awesome. So there's no facial drooping. His eyes and ears are in alignment with each other. Yeah, and yeah, the hair distribution is good. I'm looking at hair distribution. Since he has a beard and a mustache, I'm looking at consistencies and any signs of hair loss. Yeah. So I think that's it around your head. Well, I would also assess the skin color of your face. Make sure it's not flushed or pale, signs to indicate any signs of dehydration. I'm also assessing for jaundice, any yellow tint to your skin to suggest any liver disease or pre-signs of liver disease. And yeah, so now I'm gonna go ahead and assess your eyes. So I'm looking at your eyebrows and your eyelashes, making sure the air distribution again is intact and consistent bilaterally on both sides. And I'm also looking at your eyelids, making sure they're not swollen. And I'm looking at the sclera, which is just the white portion of your eyes, to make sure there's no signs of redness that can indicate any signs of inflammation, as well as yellow discoloration, which again can indicate pre-signs of liver disease. Is it okay if I palpate or bring down your lower eyelids? Hands are cold, my bad. But I'm checking your conjunctival layers, making sure that they're not red, to again indicate any signs of inflammation. Okay, I'm gonna go ahead and assess your pupils at this time.
Okay.
So what I'm gonna do is I'm gonna have you look straight ahead,
Okay.
and I'm gonna assess one pupil at a time, and making sure that they constrict. And what your pupils do, they allow the light to enter your eye, and when flashed with light, your pupils should get smaller, because they're sensitive to light. So I'm gonna go ahead and start with your left eye. Just look straight ahead. I'm gonna start with your right. Okay. I'm gonna assess the gleam in your eyes, making sure they're equal on both sides in the same position. Okay. Now I'm gonna go ahead and test your gaze. So go ahead and look at. I'm gonna attest the accommodation of your pupils. So go ahead and look at the pen, and look at a distance for a few times, and just alternate between the two. So what should happen is, when you're looking at something close up, your pupils should get smaller to be able to focus to it. When you're looking ahead, they should get bigger, which they do, which means your pupils they accommodate to distances. We have one final test for the eye test, and it's just gonna test your eyes reflexes. So I'm gonna move the pen in 6 directions, and you're just gonna follow the pen without moving your head.
Okay.
And I'm just looking for any signs of twitching. Awesome, thank you. Didn't see any signs of twitching. Cool. So that ends your eye exam. I'm gonna go ahead and move on to your ears. So I'm inspecting your outer ears, making sure there's no signs of inflammation or redness, any swelling. Is it okay if I palpate your ears? Awesome. Just palpating along the auricle, making sure there's no tenderness. And do let me know if there's any discomfort at all. And then I would retract your ear up, back, and forward to insert the otoscope, and I'm just checking for any excessive earwax, and then your eardrums, otherwise known as your tympanic membranes, for any signs of redness, inflammation, to indicate any signs of a bacterial infection, which doesn't seem like the case in the left ear. You go ahead and do the same thing on the right. So again, waiting for tenderness. Let me know if you feel any. I'm just inspecting the general overall appearance of your external ear, making sure again there's no signs of inflammation, and again checking for that inflammation within your tympanic membranes, as well as excessive earwax, which doesn't seem to be the case. Awesome. So that completes. Actually, I assessed it earlier just to make sure the ears are aligned with one another. Same thing with the eyes. Awesome. So that it's symmetrical. I'm gonna go ahead and move on to your nose now. So your nose, overall appearance, it's clear. Your skin is consistent with your ethnicity. Your nose isn't deviated to one side. It's your nares seem to be just patent, which means that they're clear. Can you go ahead and press on each nostril and just take a breath for me? Awesome. Just making sure that those airways are nice and clear. You're gonna go ahead and just inspect the inside of your nares just to make sure that there are no signs of inflammation, lesions that we should take note of. Awesome. You seem to be clear. All right. I'm gonna go ahead and if you can close your eyes, I'm just gonna hold something up to your nose, and if you can just identify what it is.
Watermelon.
Awesome. Yeah. So we're just checking to see if that olfactory nerve is intact, and that's the nerve that's responsible for your ability to smell. Okay. So now we're gonna go ahead and move on to your mouth and your throat. So I'm just looking at your overall appearance of your mouth, any lesions around your mouth, the texture of your lips, making sure that they're moist. Go ahead and open your mouth for me. I would have a tongue depressor, looking around. I would inspect the tongue, I'd inspect the teeth, his gums, and the oral mucosa, which is just the fancy term for the inside lining of your mouth. And just making sure that those areas are moist because, again, the moist texture is what protects outside pathogens or like bacteria or viruses from entering your airways. They get trapped in that moisture. Okay, so then during that time, I've also assessed your palate, your hard palate, your soft palate, making sure that there's a white tint to your hard palate and that your soft palate is about a pinkish color. Just those should be two different colors because of the proximity to the outside world. And then I would assess your tonsils, making sure that they're not enlarged or smaller than they need to be, because they also protect you against pathogens. And if there's any signs of redness in either your tonsils or the back of your throat, that could indicate that you have or you could have an infection. But that doesn't seem to be the case. There's no abnormal redness. So yeah, and then I would inspect your teeth, making sure that there's no signs of cavities, any signs of missing teeth, any broken teeth. And then I would also assess your gums, making sure there's no signs of inflammation to your gums. And I think that's it for the mouth. And then I would just, I guess back when I was assessing the head, since I'm still on the head, I'm gonna test your, if your jawbone is intact basically. Go ahead and just open and close your mouth. Okay, awesome. I was palpating to see if there was any clicking sensations, but yeah, that temporomandibular joint seems to be intact. And I think that concludes your head. So I'm gonna go ahead and move on to your neck now. Inspecting overall appearance. You do have facial hair around your neck area, so I'm just also assessing your hair distribution, and then I'm also assessing your trachea, making sure that it's midline. I'm gonna go ahead and palpate this region slightly. Awesome. Okay, it is midline. I'm gonna go ahead and just palpate your carotid pulses since I'm in this area already, one at a time, making sure they're strong.
Not both at the same time.
Alright, I'm gonna go ahead and listen to those areas as well. Okay. Nice and strong. Nice and strong. Awesome. Alright. Now I'm gonna go ahead and assess your lymph nodes. These lymph nodes are just areas where your white blood cells in your body they're located, and those white blood cells are what fight off like in infections like viruses or bacteria. And if these areas where those lymph nodes are, if they're enlarged, that means that there's an active infection that they're trying to fight off. So that's what the preauricular region, you have lymph nodes here, and then the postauricular region, you have lymph nodes here, and that just means in front of and behind your ear. And then you have your tonsillar down here, lymph nodes, and then you have your submandibular, and then you have your submental lymph nodes. And then you have your deep cervical lymph nodes, and you have your anterior cervical lymph nodes, which are on this area. And then you have your posterior cervical lymph nodes, which just means in front of and behind your neck. And then you have your occipital lymph nodes, which means behind your head. And then you have your supraclavicular lymph nodes, which rest on top of your collarbone. You have your infraclavicular lymph nodes that rest underneath your collarbone. And those should be 10 just in this general region. And then, yeah, I'm gonna go ahead and test the range of motion of your neck now. Since, by the way, there was no enlargement of those lymph nodes, so there's no signs of immediate infection or obvious signs of infection. So if you could turn your head to the right or right, and then left, and then up, and then down. We're gonna test those same regions or ranges of motion, but with resistance. Okay, go ahead and do it. Awesome. All right. And go down. Okay. And go ahead and shrug your shoulders for me. Alrighty. So you have good range of motion in your neck as well as your shoulders. So that concludes the neck, I believe. now we're gonna go ahead and assess your posterior, well, which your back basically. If you can go ahead and swing around for me, that's not too much of an issue. Awesome. So what we're gonna do is we would have him lift his gown, and then I would inspect the overall skin color of his back, noting any lesions or visible bumps, or just any discoloration, any signs of infection that we should take note of. I'm gonna go ahead and palpate your back. Is that okay if I do that now?
Yeah.
Okay, so what I'm palpating for, I'm looking for any, like just lumps or just any abnormalities that I can feel. Please do note if, tell me if there's any tenderness along these areas as well.
Okay.
Okay. Okay. Should be good. I'm gonna go ahead and assess your breathing. We're gonna start by just measuring your lung expansion. So I'm just gonna go ahead and place my hands here. Go ahead and take a deep breath for me. Awesome. All right, so your lungs are expanding equally on both sides, so that's a good thing. Because if one was expanding more than the other, that would just indicate that the one that wasn't expanding as much as the other, it could be signs of an early collapse. Of course, we don't want that. And go ahead and listen to 10 fields, or to your lung fields. So anytime I place the diaphragm on your back, I need you to take a deep breath. Okay. Awesome. Ready? 1. 2. 3. 4. 5. 6. 7. 8. 9. Breath sounds are clear. When I was looking for any signs of wheezes, crackles, or rails, those are just abnormal lung sounds that could suggest a lung infection. But I didn't hear any of that, so that's good. So now I'm just going to assess your kidneys, making sure that they're not tender, which again, if they are, that could also indicate signs of maybe a urinary tract infection or maybe inflammation of your kidneys, which, I mean, their job is to filter your urine and all the blood, the waste from your blood into your urine. So if those aren't working correctly, that could potentially lead to a blood infection as well. So I'm gonna go ahead and just palpate around where your kidneys are, below your lungs, and I'm gonna just let me know if there's any tenderness. Okay, awesome. And that's about it for your back. So now go ahead and make your way back over here. I can inspect the front of your chest. Awesome. So now I would have him lift his gown from the front side, and I would just inspect hair distribution, any discoloration, any visible lumps that I can see. I would also inspect the size of his chest. I'd probably look at it from a lateral perspective to see if it's barrel chested or if he has like a barrel sized chest, or if it's normal, concave, but it just seems like he has a normal chest cavity size. Okay, so then I would go ahead and palpate. I'm gonna palpate the front of your chest. Is that okay?
Yes.
Awesome. So go ahead and palpate. Once again, let me know if there's any tenderness at all. Okay. Awesome. So then I'm gonna go ahead and test your lung expansion as well, but this time on the front side. So once again, take a deep breath for me. Awesome. That is symmetrical on both sides. Awesome. So now I'm going to go ahead and listen to your breath sounds. Oh, goodness. All right. Once again, every time I place the diaphragm onto your chest, just take a deep breath for me.
Okay.
Okay. Alright, once again, no signs of wheezing, rails, or crackles, so your lung sounds are clear. Is there anything for lungs? I think that's it for lungs. Okay, so now I'm gonna go ahead and inspect your cardiac. It's in the same region, but I'm also, this time I'm gonna be listening for heart sounds. But right now I'm gonna be palpating your apical region, which just is along the left midclavicular line, in the fifth intercostal space. How I would find that is, I would locate the angle of Louis, and I would drop down to the second intercostal space, and then I would just count down 4, 5, and then I would go from the fifth intercostal space down to the left midclavicular line, and then I would have the apical pulse right here. What I'm palpating for is any signs of thrills, to see if there's any abnormalities in the vibrations that your heart is making while it's contracting and pushing blood through your system. I don't feel any thrills. I can also palpate for general thrills in the cardiac region. Once again, I don't feel any. I will also assessing heaves. Heaves are just abnormal contractions of the heart that can suggest signs of cardiomegaly, which is just enlargement of your heart. And that would just be obvious because your heart would be, if your heart is bigger than it is, it would be, you would have much higher or much wider chest compressions in this general area, which I don't see any signs of. So now I'm going to go ahead and auscultate your 5 major cardiac regions. So I'll just point out where they are before I do so, just so I can hear my own voice. So I would locate the angle of Louis, which is right where above your sternum is, and I would drop down to the second intercostal space. This is where the aortic area is, and then in the second intercostal space on the left side, just across, would be your pulmonic region, and then just below that would be your Erb's point in the third intercostal space, and then I would drop a little bit to the left, but to the fourth intercostal space to locate your tricuspid region, and then I would drop again to the right a little bit to your fifth intercostal space, again where your apical pulse is, but it's also where the mitral area is. So then I'm gonna listen to those five areas. Just pretty normally. And then I'm just assessing for the normal loved up sound that everybody knows about, the heart sounds, S1 and S2. Angle of Louis, second intercostal space. Loved up, I found it, S1 and S2. S1 and S2. This is Erb's point, S1 and S2. This is the tricuspid region. You can hear the S1 and S2. This is where your apical pulse is. This is where the bottom of your heart is. And it's nice and strong, the S1 and S2. And now I'm going to assess that same apical pulse region for any signs of bruit, otherwise known as your S3 and S4 sounds. Those shouldn't be present. I don't hear anything. Awesome. Cool. So, yeah. Cardiac region. I don't think there's anything else for cardiac region. Awesome. So now I'm gonna go ahead and assess your abdomen. Ideally, I would have assessed your cardiac region as you were laying down. I would say that, but so I'm just gonna go straight to your abdomen now. So I'm gonna imagine that there's a line between. I'm gonna stand on this side.
Okay.
Yeah, just so there's more space. So to assess your abdomen, I have to assess 5 different regions, but I have to split the general areas into 4 different quadrants, and your umbilicus or your belly button is the middle. So just imagine there's a vertical line running down the middle, and as well as the horizontal, and that just separates your abdominal cavities into 4 regions. So I'm gonna assess. I would have you lift up your gown, and then I would just generally with my eyes inspect the 4 quadrants, making sure that there's no abnormal like bumps to take note of, because that could be a sign of like a hernia, and then or any discoloration again, and like abnormal hair distribution suggests any lack of oxygen supply to those areas, to those regions. Excuse me. Yeah, I don't see any signs of abnormalities. I'm gonna go ahead and palpate. Actually, I'm gonna go ahead and auscultate first to listen to those regions before I palpate. Okay, so I'm gonna start off with your right lower quadrant, making sure those vowel sounds are present. We'll go up to your right upper quadrant. Yep. And then listen to your left upper quadrant. Hear those vowel sounds nice and present. And then your left lower quadrant. Well, I guess it'll be more this way. Vowel sounds are present, and then your upper gastric region, which is right around where your stomach sits. Making sure there's vowel sounds present. Okay. Vowel sounds were present. There weren't too many. Ideally, I would listen to for at least 20 to 30 seconds in each region, just so I could assess at the approximate speed and how many, the frequency of those vowel sounds, basically. I'm gonna go ahead and palpate those same regions. Is that okay if I do that?
Yeah.
Awesome. Cool. Just checking for any lumps, any abnormal masses, any tenderness as well. Let me know. Cool. And then left lower quadrant, and then the upper gastric region once again. Awesome. Yeah, and I think that's it for your abdominal. If you go ahead and prop up for me again,
Sure.
off the edge of the bed. I'm gonna go ahead and assess your lower extremities. Okay, so I'm gonna start off with palpating your joints.
Okay.
So I'm gonna go ahead and start with the hip, just making sure that there's no tenderness. Let me know if you feel any tenderness. So the knees, so the most important joints are your hips, your knees, and your ankles. And your whole foot is technically a joint, so I'm also palpating those regions as well. No tenderness at all. Awesome. That's it for your lower extremities. So now I'm gonna palpate your pulses, your major pulses. So your popliteal pulse it's right on the inside of your knee. So I'm just palpating that, and then palpating on both sides, just make sure they're equal. Now I'm gonna palpate your posterior tibialis pulse in both regions, making sure that they're nice and present. Pulses are +2, that just means that they're normal. If they were +3 or +4, that would mean they would be stronger than normal, and that would indicate that your heart is pumping blood faster than it should. Cool. And then your pedis dorsalis, or dorsalis pedis pulses, they're nice and strong, +2. Awesome. So your pulses are assessed, and then I would have you lift up your pants, just so I can down up the length of your legs, so I can assess hair distribution, any discoloration, any discoloration as in redness, any cyanosis to indicate hypoxia, or jaundice again to indicate signs of pre-liver disease, or just redness for inflammation. And then I would just say, or increased vasculature as well, which just means that the veins and the arteries in your legs they're getting bigger, and that could just indicate like there's a blockage or perhaps a blood clot somewhere. So I would assess the vasculature. Yeah, and then I would check the calprefil of your toes. So I would I would apply some pressure at the end of your toes, and then watch. They would ideally get white, and then I would watch to see how fast they return to normal, and that response time should be less than 2 seconds, which it does seem to be the case. Awesome. Now I'm going to go ahead and test your range of motion. So if you could just, I'm going to test the range of motion of your hips. So if you can spread your legs that way, yep, and then back. Now with resistance, back, forward, awesome. Now if you could flex your knees or your legs, just bring them forward, and then back, and then do it without resistance. Awesome. And then go ahead and rotate your ankles for me. Awesome. Now go ahead and push on my hands with your feet and upwards. Awesome. Go ahead and raise your legs. Okay, and then yeah, there we go. Press them down. There we go. All right, so normal range of motion in your lower extremities. Now I'm gonna go ahead and assess your upper extremities. So then, ideally, he would have no sleeves. The full exposure of his skin would be exposed, and then I would assess for any discoloration in his, any discoloration, any blueness, cyanosis, any redness, any yellow tint. just as I did with the lower extremities to indicate those same signs of either inflammation, any hypoxia, or jaundice. And then hair distribution, making sure that they're nice and symmetrical. He doesn't have more hair on one arm than the other to indicate any signs of lack of oxygen to one or the other extremity. Then I would palpate his joints. So the shoulder's a major joint, making sure there's no tenderness in his elbow as well, or the wrist. And then I would check capillary refill in his fingers as well, making sure that they come. Can you go ahead and invert your hands?
Mhm.
Yeah, there we go. Yeah, making sure that he has good cap refill in his right hand as well as his left hand. Awesome. And then I'm also just checking the overall appearance of the extremities, making sure that they're okay. Yes, and I'm just gonna test. I'm gonna go ahead and palpate his pulses again, but this time in his upper extremities. So just making sure that they're nice and strong. +2, his radial pulses, and then I palpated his brachial pulses when I was doing his blood pressure, but just to palpate them again, making sure that they're nice and strong. And now I can just test range of motion. So go ahead and just lift your arms up for me, back down with resistance, and then back down. Awesome. Go ahead and flex your elbows for me. Rotate your wrists. All right, that's yeah. Okay, and go ahead and pull on my fingers. Push on my hands. Awesome. He has good range of motion. Go ahead and just to double check, shrug your shoulders. Awesome. Cool. And I think that's it for your arms. Oh wait, no, yes, I think that's it for your arms. Oh, also take your I have to also take your pulses. When I was assessing for your pulses, it's important to listen to them as well. Yeah. Oh yeah, nice and strong. Awesome. Okay, I think that's it for upper extremities. Now I'm gonna go ahead and test your reflexes. So I brought along my handy dandy reflex hammer. So I'm gonna go ahead and start with your bicep. Your bicep has a reflex right here in the antecubital region that I can just place a finger over, and I'm just gonna tap with the point of my reflex hammer. And then what should happen is your biceps should just should flex. Awesome. Go ahead and check that bilaterally. Awesome. And I'm gonna test the same thing, but with your triceps. So I'm gonna go ahead and the funny bone. I'm gonna be hitting the funny bone. Ready? Awesome. Go ahead and check that bilaterally. Okay. Now I'm gonna go ahead and check your brachioradialis pulse, and that's located right here. What should happen is I'm gonna tap this region right here of your arms, and then your forearm should flex. Okay. So just around right here. Awesome. Same. Alrighty. Those pulses those reflexes are intact. Now I'm gonna go ahead and test your patellar one. So I'm gonna bang your knee with the flat side of this hammer, and your knee's gonna flex. Okay. And we'll do the same thing with this side. Awesome. Now I'm gonna go ahead and test the Achilles reflex. What should happen is your foot should flex forward. Alright. Seems like those reflexes are intact. I'm gonna go ahead and have you stand up. Okay. Just test your gait. Can you just take a few steps around the room? Awesome. Observing his posture, observing how he's his coordination. Sounds good. Go ahead and close your eyes for me and extend your your arms. Just checking your balance. Awesome. That's what's called the Romberg test. And I'm just gonna assess your spine, making sure the curvature is there's no abnormal curvature. Ideally, he would have his shirt off and his gown off. Go ahead and bend forward for me.
Yeah, sure.
Yeah, we're gonna go ahead and palpate the spine, making sure that there's no abnormal vertical curvature. Yeah, sounds good. Yeah, I think that's about it. think that does conclude this comprehensive assessment. Do you have any questions for me at all?
No questions.
No? Awesome. Okay, I'm gonna go ahead and document my findings. There was nothing that I found abnormal, but I will double check with the provider, show him all of the results, and then if he has any further tests or assessments, we'll have him come and review them.
Sounds good.
Alrighty, thank you, Steve.
Thank you.